Hi everyone, this is Anatomical Terminology 1.815 by Vanessa Garcia. So what is anatomical terminology? This is terminology that is used by anatomists and all types of practitioners to identify specific areas of the body. This helps whenever someone is trying to, let's say, go to the doctor and describe some type of pain that they have, and instead of describing it as, well, the doctor at least describing it as like pain in the stomach or pain in the lower left abdomen, we have more specific terms to use. And this is used whenever the person is standing up straight with their palms out forward, facing forward, and their feet slightly spread apart. So this would not work if someone is laying down or sitting down. And we do have certain terms that we can use, like there's a midline that will separate the body in equal halves. There is the medial and lateral lines, which the medial line explains, would pinpoint anything that is closer to the midline, as opposed to lateral would be anything that's further out. And then whenever you look at a person, the way we see them is not the way we would call their left and right side. Like their left to us would be our right side, but we would actually point it out as left and right. So it would be the opposite way. And we do have the superior and inferior. And superior is anything that is towards the head, such as like the head being superior to the abdomen. And then inferior is anything below that goes towards the feet. So the navel is inferior to the chin. And there is also distal and proximal directions, which would be the elbow being proximal to the wrist and the knee being distal to, like, let's say the thigh. We can also cut the body with the front and back side, which would be anterior and dorsal. So the belly side is the anterior, the back side would be considered dorsal. And there's also superficial, which is anything that's on the surface of the skin, nothing too deep. The body planes can also be cut as like a frontal plane, which is anything that is the front and the back half, like the dorsal and anterior sides. The sagittal plane is similar to the medial, where it's going to cut the body in equal halves, left and right. The transverse will split it, top and bottom halves. And there's also an oblique plane that'll cut it at an angle, which isn't often used as opposed to the other angles. Now we have the abdominal pelvic region, which can be separated into four quadrants, which will be right, left, upper, and lower quadrants. And the right upper, would have, like, let's say the kidney and a part of the stomach. And the lower right would have the appendix and small intestines and part of the reproductive system. And the left side would have the liver, pancreas, and the left lower would have the small intestine and also the rest of the reproductive system. And it can be further broken into 9 pieces, which would look like a tic-tac-toe, and it's for more specific areas. Like the center of it would be the umbilical area, which would be like the belly button. It would have the colon and parts of both the left and right kidney. The hypochondriac regions would have the liver, pancreas, and the spleen, kidneys. So it can all be further broken down to specify exactly where the pain could be coming from. And that is it. That is your anatomical terminology. Here are the resources.